Hello, I'm Judy West, Chief Human Resource Officer from Maine Health. Thank you for joining me for this e-learn on unconscious bias. A critical step in cultivating an inclusive, patient-centered work environment is recognizing and mitigating our unconscious biases. By becoming more aware of our unconscious biases, we further embed respect, integrity, and ownership into our culture. A bias-aware culture treats every member of its community, patients and employees alike, with respect and integrity. By being aware of our unconscious biases and owning our behaviors, we take responsibility for our actions and approach the challenge of reducing bias with optimism. It is important we understand how it will improve our decision-making, strengthen our community, and improve our quality of care.
How many of us would admit that we are biased? While most of us have been taught that having bias is something we should be ashamed of, it just so happens that being biased is part of being human. 90% of the interactions in the workplace that favor one group versus another are not made by those who are out to get someone, but by all of us who have blind spots. In fact, these blind spots often contribute to unintended incidents of bias against minority groups and women. Regardless of intent, these types of biases in the workplace harm all of us and are counter to our value of respect. Therefore, it's important for each of us to consider how we interact with others to mitigate negative bias in our workplace. Let's take a look at how bias is established. Our brains have evolved to be biased as a means of survival, to help us organize our thinking and enable us to think quickly. For example, a hunter-gatherer whose brain responds quickly to the threat of a snake is more likely to survive than one who carefully considers whether the snake is poisonous before deciding to avoid it. The problem is that these biases, or mental shortcuts, may be efficient, but they're not always accurate. They can cause us to jump to conclusions or make poor decisions or judgments that impact our interactions with others. In our fast-paced, high-volume healthcare setting, many of us are asked to make quick decisions every day. Unfortunately, biases tend to accelerate when we have to make decisions quickly, making it all the more important for us to pause and observe our automatic assumptions. Doing this will not only help us to become more aware of our biases, but will lead to better workplace decisions, outcomes, and even higher levels of patient care. What is unconscious bias? Unconscious bias is accidental, unintended, subtle, and completely unconscious choices made by everyone all of the time. The brain detects patterns unconsciously, simple neuronal associations. They allow us to think efficiently, though not always accurately. Let's do a quick exercise to explore this concept. A racket and ball together cost $1.10. The racket is $1 more. How much is the ball? Most people say 10 cents. Although this response intuitively comes to mind, it is incorrect. Here's why. If the ball cost 10 cents and the racket costs $1 more than the ball, the racket would cost $1.10 for a grand total of $1.20. The correct answer to this problem is that the ball costs 5 cents and the racket costs, at $1 more, $1.05 for a grand total of $1.10. It turns out 50% of Harvard and Princeton students got this wrong. Not because they can't do simple math, but because, like all of us, they take mental shortcuts. Let's look at another real unconscious bias example from a healthcare setting. At a well-known academic medical center, a child presented with difficulty breathing that baffled the care team. The team of physicians was agonizing over a light box, reviewing the patient's x-rays, puzzled because they couldn't determine a diagnosis. Another physician, just passing through, looked at the x-rays and immediately said cystic fibrosis, the correct diagnosis. It turns out cystic fibrosis is often thought of as a white disease. The team of physicians working with the patient was tripped up by the patient's race, which was black, and therefore failed to recognize the correct patient diagnosis. So, if we're all biased, what do we do now? First, we can embrace that we are all biased and then consciously work to mitigate the negative effects of unconscious bias on our workplace. Working to mitigate our biases will lead to a more inclusive, respectful, and patient-centered workplace. As a first step, Let's learn about how to identify when bias is occurring. If our biases remain unconscious, we'll be unable to transform them, and we'll run the risk of unintentionally giving preference to certain groups of people and excluding others. There are many different types of biases that can occur in our brains. However, there are a few that are more likely to show up in the workplace. Let's take a moment to look at a few common forms of bias. To do this, we'll look to the acronym PACE. PACE reminds us to slow down and observe our biases before making quick decisions. The first is proximity bias. We have a tendency to prefer things that are closest to us versus distant. Proximity bias is common in people and workplace decisions. For example, you may promote or select someone you see every day for a project, rather than a more qualified candidate who works in a different location, because you're more familiar with the people and work being performed closest to you. Do you have a tendency to consider the people most immediately around you first? Being aware of this potential bias is especially important at an organization like ours, where many of our coworkers are scattered across Maine and into New Hampshire. The second bias is affinity bias. We, as humans, have a tendency to feel an affinity towards those that are similar to us. Affinity bias is likely to occur when people have to select one person over another person, perhaps in establishing a team, hiring a new person, or considering who should receive a promotion. For example, you may be more likely to hire someone who has a similar background to you because your interaction is comfortable and familiar, even though they might not be the best candidate for the job. This doesn't just apply to managers. Even choosing to have lunch with colleagues you know can mean that, over time, you don't get to learn about and appreciate the talents of other colleagues. This form of bias often plays out along gender and minority lines. Take a moment to think about your own workplace decisions and processes. Does affinity bias accidentally creep in? The next bias is confirmation bias. Our brains have a tendency to confirm our preconceptions and trust our perceptions over the perceptions of others. Confirmation bias is likely to occur in creative and people decisions. For example, a patient may describe their pain score as extremely high, but you find yourself questioning the patient's actual pain level based on your own experience. In this instance, you have time to get additional information about the situation, the patient's pain score, but you unconsciously ignore that information because you trust your perception over the perceptions of others. Studies have shown that men receive pain medication more quickly than women, within 47 minutes on average compared to 65 minutes for women, even when they report the same pain scores. Additional studies have also shown that minorities are undertreated for pain relative to white Americans. These are examples of how unconscious bias can negatively impact one group over another, even when we consciously wouldn't want any of our patients to suffer from unnecessary pain. Lastly, expedience bias. As humans, we have a tendency to trust our gut feeling, especially when asked to make quick decisions. Expedience bias is common when we hurry or experience high cognitive load. For example, when diagnosing a patient, going with your gut feeling or a recent diagnosis rather than examining all of the facts first. Consider a time when you were in a hurry to make a decision. Was your instinct correct? Did you find out later there were more facts to discover or additional input to consider? You might have been experiencing expedience bias. Now that we've learned about common forms of unconscious bias in the workplace, how do we become an organization that actively works to mitigate biases that unconsciously make their way into our decision-making and our processes? Because biases often surface in the decisions that we make, we'd like to present a framework to help each of us slow down and reduce our biases as we carry out critical people, workplace, and patient care decisions. As you make decisions throughout your day, we encourage you to look at the facts. Focus on the facts to mitigate expedience bias. Ask others for their ideas and opinions to mitigate confirmation bias. Consider commonalities and distance between yourself and others to mitigate affinity and proximity biases. Try on others' perspectives to mitigate all biases. Share your thoughts, ideas, and perspectives to help others mitigate their biases. How do we do this? Embrace. First, embrace that we all have biases. It's how our brains are wired. Reflect. Then reflect on what types of biases might be occurring in your daily processes and decisions. For example, I've noticed that in our team meetings, those on the phone don't speak up as often as those in the room. Identify. Name the bias that you want to work to mitigate. In this case, proximity. Mitigate. Look to the facts to determine what strategy you might use to help mitigate proximity bias. Consider the proximity between myself and others. In order to truly change our behavior, we need to make this actionable and incorporate our new way of doing things into our daily habits. To do this, we suggest a scientifically tested approach called the When-Then plan. One study by the British Journal of Health Psychology found that people who created when-then plans were 53% more likely to change their habits than those who didn't plan. This is because the when-then plan allows people to break their habits down into actionable steps, thereby allowing new, less biased habits to form. Let's see how this works. To create a when-then plan to mitigate proximity bias, I'll note what specific action I'll take to change the bias I've identified. When I'm leading a team meeting, I will consider the proximity between myself and others, and then ask the people on the phone for their input first in order to ensure their ideas aren't missed or overlooked. By writing down and identifying what behavior you want to change and when, you're much more likely to follow through on your commitment and form new habits that challenge your unconscious biases. Let's look at one more example of a when-then plan. Embrace. Embrace that we all have biases. It's how our brains are wired. Reflect. When working with patients, I find myself jumping to a diagnosis too quickly when I'm feeling pressed for time. Identify. The bias I want to mitigate is expedience. Mitigate. Then I'll look to the facts to help me mitigate my expedience bias and create my when-then plan. My when-then plan is, when working with patients and feeling pressed for time, I will focus on the facts and then pause to observe what I actually know about this patient's symptoms before making a diagnosis. Take a minute to jot down your own when-then plan to help mitigate one of your biases. Embrace, reflect, identify, look to the facts, and then create your when-then plan. Share your when-then plan with a colleague or manager and help each other embed your new behaviors into your workplace processes. Let's review. What have we learned in today's Unconscious Bias eLearn? Unconscious biases manifest themselves in subtle, unintended, and unconscious ways that can negatively impact our decisions and interactions, our coworkers, and our patients. It's not uncommon for unconscious biases to negatively impact minority groups and women. Working to mitigate our biases will enhance our culture of respect, integrity, and ownership, ultimately creating a more inclusive and patient-centered work environment. The first step in mitigating bias is to embrace that we all have biases. Reflecting on our assumptions, identifying bias, and then actively working to mitigate them by looking to the facts can help us improve our decisions and our quality of care. By looking to the facts and using when-then plans in our daily practices, we can transform our habits and behaviors to become an even more respectful and inclusive workplace.
Maine Health is dedicated to providing all employees a safe and respectful work environment in which all employees are treated with respect, feel valued, included, and have access to resources to support them when they have questions or concerns. Maine Health has zero tolerance for discrimination or harassment. Your overall health and well-being continue to be a priority for Maine Health. Thank you for taking the time to complete this eLearn and for all that you do in making Maine Health a respectful and inclusive workplace.